Good evening and welcome to our COVID-19 update. I am Ladi Akeredoluale here at the highlights at this hour. Federal government shows how increased number of cases of COVID-19 infections is the result of citizens not taking responsibility for their actions. Presidential task force commends some state governments over building infrastructure for COVID-19 management. And World Health Organization warns that the COVID-19 virus economic effects will be around for decades. It criticizes lack of global leadership in fighting the pandemic. The Secretary to the Government of the Federation and Chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, has raised an alarm over the increase in cases of COVID-19 in the country. The PTF chairman, during his opening remarks at the start of the very first presidential task force briefing on COVID-19 today in Abuja, reeled out statistics which suggests that community transmission is now on the increase. In collaborating that position, the national coordinator of the presidential task force, Dr. Sani Aliyu, attributes the spread to factors like conspiracy theories, disbelief, as well as poor compliance.
In April 16, 2020, we had a record of 442 cases. By May 16, 2020, barely a month, the figures had risen to 5,621 cases. And by June 16th, another month thereafter, 2020, we had on our records of confirmed cases 17,148 cases. By today, we have on record over 20,000 reported cases. We really have a choice to make, and there is an urgency of yesterday in our choice.
Nigerians have continued to show persistent and remarkable lack of compliance to COVID-19 prevention protocols, which is quite worrying, really. In the cities where adherence to these protocols were high in the initial 2 weeks of the eased lockdown, progressively over time, citizens are letting down their guards, and this remains of grave concern. There is partial to total non-compliance with face mask and physical distancing protocols by the public. Many Nigerians only use their face masks either to avoid security agents, or that is where enforcement exists, or where they are told to do so. There's also significant disbelief in the danger and impact of COVID-19. In parts of the southeast where we did a recent survey, 60% did not believe that COVID was an issue at all. We clearly are not taking the pandemic seriously enough. There are also many myths that continue to exist within the social media platforms, ranging from conspiracy theories to get-rich-quick gains, to claims of treatments by herbal concoctions, etc., all of which appear to be really putting our sensitization efforts at risk.
Meanwhile, the Minister for Health, Dr. Osagie Ehanire, has also been speaking on how this spread can be reduced. According to him, the federal government is building a comprehensive response plan which will help position the country on a pedestal to tackle health challenges of such magnitude. He goes on to give insight on causes of the deaths recorded for COVID-19 so far.
This will not be the sole responsibility of government, but of all citizens, individually and collectively. It is also the prime feature of the National COVID-19 Health Sector Response Action Plan of the Federal Ministry of Health, which tries to map a near, medium, and long-term health sector response strategy to the challenge across all areas of health. over the next 3-year period. The plan is to be presented at the National Council of Health and applied to states for the development of state-specific action plans to address state peculiarities. Some of the fatalities recorded in our country may possibly have been saved if they had arrived at designated treatment centers early enough. It is also emerging that the clinical condition of COVID-19 patients, especially the elderly and those with underlying illnesses, which we call the vulnerable, can change from mild to critical within such a short time that patients hardly have time to seek hospital care.
The Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwazu, is full of commendation for 4 Nigerian state governors for their investment in health infrastructure to tackle the COVID-19 pandemic. The NCDC boss also highlights how investment in response to special health challenges has made for smooth transition and handling of the coronavirus.
Oyo State historically has suffered from Lassa fever outbreaks. We all know about that. But in the midst of that, they've also developed the Rural Specialist Teaching Hospital, one of the premier hospitals that has developed the capacity to respond to infectious diseases. But beyond Irua, we saw and met a very dedicated team at the University of Benin Teaching Hospital led by Professor Baseki at the Stella Obasanjo Hospital in Benin, and really saw a committed set of clinicians that were working very hard, innovatively to deal with the challenge in front of them. But really most gratifying was the leadership of the governor of Oyo State, Governor Godwin Obaseki, in how he had driven this response, personally led EOC meetings every morning to deal with the outbreak, understand the data, and use the data to respond to the outbreak. In Plateau, we went primarily also to commission a new treatment center at the Bingham University Teaching Hospital. This treatment center was funded by the Basic Healthcare Provision Fund, which was established a few years ago, and the development of this literally was because of the increased number of Lassa fever cases in Plateau. So these cases of Lassa fever had led us to making a small investment in developing the capacity to treat that. We didn't know that they would need this center for the management of cases of COVID. So that's another example how investments in health preparedness in one area supports health response in another. The level of investments by the state government in Akwa Ibom is probably parallel to no other. They've built a brand new treatment center, a brand new lab, a brand new EOC, all with state government resources. So really investing aggressively in public health in a way that probably would not have been fathomable many years ago. But it also shows the level of seriousness that states are now taking this problem with and actually investing money in the response. We ended up with Lagos. It was a short visit in Lagos. We were swapping teams. A team was coming back, a new team had taken over. So the visit in Lagos was really to encourage them. The teams have been there for quite a while now to keep pushing and supporting Lagos.
Going to Oyo State, where all civil servants today resumed at their duty posts after almost 3 months of staying at home. As part of the increasing number of COVID-19 cases in that state, workers resumed at the state secretariat, which had been shut since March the 27th and was partially reopened on April the 27th to staff from grade level 13 and above. Our correspondent, Bukola Oriowo, has more.
Despite the daily increase in COVID-19 in the last 1 week in Oyo State, workers today resumed at the Secretariat. Although in the last 3 weeks, from grade level 13 and above have been reporting for duties, but now all workers at various levels have resumed today, and we felt the pulse of some of them while they were coming in the morning, and just to know their preparedness and how they feel concerning the rising cases and their resumption. A lot of them actually do not show fear. They believe that once the safety protocols are observed, that there will be no problems.
Actually, I'm a civil servant teaching by profession. But all the workers here today, they were fully happy that they resume in peace, not in pieces. Likewise, I know all the staff here will also happy. So I think it's okay. People should just be, exhibiting the social distancing rule and, maintain hygiene and all that. There hasn't been any cases. We don't know, but there hasn't been any open cases, about the people who work here. As in generally, are you getting it now? So I think the government have seen that, they've taken it into consideration.
Seeing workers resume today with their face masks and a lot of them practicing hand washing and safety distance is impressive. This, however, must trickle down to the larger society. Our marketplaces, public places, bus stops, malls must also imbibe these to become a culture until this pandemic blows over. Face mask use must be enforced. A lot of them have actually called for enforcement on the part of government. Whether this would happen, we do not know. But events in the coming days will determine that. For COVID-19 updates, Bukola Oriowo, Channels Television News.
From Oyo State, let's go to Niger State, where the budgetary allocation for the health sector has never hit the 15% declared by the federal government, and this is a source of concern to stakeholders in the state. Only in 2020 has the allocation risen beyond 11%, and with the COVID-19 pandemic, there appears to be pressure on the sector. Our correspondent Emperor Simon gives us more from that state.
The sum of 150 billion naira was what was initially approved for the 2020 budget in Niger State by the State Assembly. However, in March this year, with the emergence of COVID-19, that budget was slashed by 36%, bringing the budget size to 98 billion naira. The health sector was to benefit the sum of over 6.2 billion naira from the initial budget presented by Governor Abubakar Bello at the Assembly. And that was 11% of the budget. At that time, there were even concerns that the budget for health had not hit the 15% approved by the federal government. However, there was also commendation based on the fact that that budget saw an appreciable increase in budget allocation for health sector in the state. Earlier today, we were at the State Assembly where the Technical Working Committee from the Ministry of Health paid an advocacy visit to the legislators to seek their support in canvassing for increment in financing for health.
As you all know, financing is something that it has been budgeted for. It has been in the budget already, but because of the pandemic and what have you, the government have a way of sourcing resources to be able to tackle the problem on ground. And as far as today's program is concerned, what we are looking at is how to be able to pull in money so that this program can succeed. As a legislature, they have come in with their presentation. We are going to look into the presentation. We'll sit at the committee level to see how we'll work it out and be able to, advise appropriately, most especially to the Ministry of Finance, to see that funds are being released.
Meanwhile, we know that the Niger State Task Force on COVID-19 says it has spent the sum of over 795 million naira on the COVID-19 pandemic. From Niger State, Emperor Simon for COVID-19 update.
All right, thank you so much, Emperor. Now, let's take a look at some of the issues raised by our reports earlier on today. Dr. Doyin Odubanjo, public health physician, joins me in the studio here. Thank you so much for your time.
Pleasure.
Welcome.
Thank you.
Now, virtually every member of the Presidential Task Force today tended to harp on the link between this non-compliance and the rising number of cases that we have. And in some instances, they're even pointing at external examples for where we might end up being. And that we need to make a choice about this now before it is too late. Do you think they're being alarmist in any way?
No, not really, because it's the same message since the beginning, really. But this is something you control by controlling human behavior, especially once you have community transmission. Because basically what it means is that people are passing it from one person to the other, and that's why we have to take personal responsibility, for how we prevent the spread. And for instance, the basic thing like wearing your face mask is expected, especially once you arrive in a crowded place and all that. But again, we still see people in the buses and all that not wearing it. And that basically means you can hand it over to the next man in the bus, or you could receive theirs if they were carrying the virus. So this is something that is expected. We all must take personal responsibility for controlling the spread.
One of the things that seems to have also occurred is that there is the talk about this increase in cases also coming from the fact that we are doing more testing, that more people are being tested, because the health minister pointed out that we have now done close to 100,000 or over 100,000 tests. That's why it's expected that as we test more, we're likely to find more people who are going to be positive. So maybe the numbers are not as bad as they first appear when you see them. Is this a case of...
No, not quite, because if you first started from the fact that we are still not testing enough. So the issue will be that we probably have a lot more
to find out.
Yes, that we haven't even found, that exist in the community in the first place. But it is correct to say that the more you test, the more we are finding. But then it's actually perhaps worse than that, which is to say that even though we're testing more, we're not testing enough. Therefore, there are more than likely many more folds of the numbers that we are seeing out there in the community.
I must ask you, of course, about the issue of the health budget. Because a lot of people have pointed out that already there were complaints that the budget was already quite low. And that one expected that with this kind of pandemic, the budget would rise. The figures do not support that assertion. Rather, because of COVID-19, the figures have in fact been slashed. Where do you see that leading us?
I think it's been caught between the devil and the blue sea. You don't have income, because unfortunately we've had to shut down. So I always talk about the pandemic not being a single pandemic. It's also an economic pandemic, a social pandemic, all coming out of a health situation.
That's right.
So it's really difficult because now to control the health crisis, you have to shut down, which means you have to cut out your own money. So you don't make the money. And yet you're expected to spend on the health. So that's the challenge we're faced with. However, the question will be about how you prioritize what you spend on. That's the real key. The drop in the spending, yes, that's expected. You just don't have the money coming in. But where do you put the money will be the real big issue.
Where should we put the money, even the little that we have now? Because people are saying, yes, there's COVID-19, but there are all these other things that we need to be dealing with as well. Lassa fever, HIV, malaria, tuberculosis. We've just gotten out of polio. And so we also must be treating all those along with in this amount.
Absolutely.
So what's your take?
Well, actually, looking at the whole health sector, if you talk first from that perspective, one of the things we discourage is having silos of health responses, where you are dealing with, you run a polio program separate, you run a Lassa fever response separate from the rest, and you have all this funding for all of them. And we think you should rather be looking at the health sector as a whole. And in that case, for instance, there's something we call integrated disease surveillance and response. So it's that kind of system that has not been as functional as it should be that we need to have. Even given the fact that a place like China that seemingly, you know, clapped and said, yes, we've done it.
We've dealt with this.
Started seeing a return, you know, with people coming back from other countries and whatnot. And in some cases, they don't even know where it's coming from. However, with a good IDSR, the Integrated Disease Surveillance and Response, you can pick up any problems that arise, be it Lassa fever, be it COVID, whatever. You can pick it up and you can respond adequately to it. But I also think that one of the things COVID is showing us is the problem we have with personnel. You know, and I think no matter what we do, we must address that. Because if we can be faced with the kind of crisis we've faced with personnel, thank God the resident doctors called off the strike, if we could see the issues being thrown up, it tells us that we have a serious problem there. So personnel will be one, the disease surveillance and response will be one, and then altogether we really need to look at our primary health care system.
Indeed. Dr. Oyo State, thank you so much for this. Thank you for your time. Thank you for joining us.
My pleasure.
We'll take a break, and when we come back, we'll talk a little bit more about the healthcare budget from different perspectives. Please stay on with us. Thanks for staying tuned. Even though the National Association of Resident Doctors has called off its strike, the Association of Joint Health Workers today staged a peaceful protest to the management of the University College Hospital in Ibadan, Oyo State, demanding to be included in the payment of hazard allowances approved by the federal government. The workers who assembled at the entrance of the Chief Medical Director's office argued that all health workers are at risk during this fight for the pandemic and no one should be left behind. They noted that the payment of hazard allowance to only medical doctors is unacceptable and should be addressed as soon as possible. Let's talk to the Chief Medical Director of the University College Hospital in Ibadan, Professor Abiodun Otebayo. Good evening, Professor Otebayo. Thank you for your time. Professor Otebayo joins us via Skype from Ibadan. Professor Otebayo, what is it that you're going to do about what the workers are asking for?
Well, let me just first correct the statement you made that only doctors were paid the hazard allowance. That is not correct. Doctors, some categories of doctors were paid 50%. Another category of doctors paid 40%. But the non-health workers as classified were paid 10%. And what the NASU and the senior staff were protesting in UCH today is that the payment of 10% hazard allowance to them was unacceptable because all of them are health workers and they are exposed to hazardous conditions at work. So they came to my office in a peaceful protest to say that 50% is what they also want. And answering your question as to what I'm going to do, I made them to know that salaries are now being paid centrally through IPs from Abuja and not from UCH, but that I will take their message to the appropriate authorities. And I've already done so because I had to call my board chairman, Alhaji Shatima, to help escalate it to a higher level. And he called me back to say that he's been seeking audience with the Honorable Minister of Health and the Minister of Labor and Productivity. So that is what we have done so far.
Prof, I allowed you to finish with the statement, but I needed to also correct you. I never said that anybody had been paid. What I said was that they asked to be included in the payment. I never said anyone had been paid because we don't have the report that anybody has been paid or hasn't been paid. I'm just reading what it's reported. So it wasn't said that they had been paid or that anybody had been paid. But thank you for the clarification about the percentages, which is what is important. Now, moving on, the other part of this is that the question about hazard and other allowances, given the fact that you are an administrator and the fact that you pointed out now that salaries are now paid centrally, so there is very little that those on the ground in each institution can do. do you not think it's about time that there should be some kind of central position on this matter so that individual institutions do not have to embark on any kind of protest or any kind of march to get their own views across?
Well, thank you for that statement. Actually, what needs to be done, which is the central payment, is appropriate and is in order. And that will not stop individual protest. Because when I was speaking with the executive members of the non-academic staff union today, they wanted me to come to address them. And I said, would that change this situation? Would that make you have your money? But they told me smartly that they know that if they protest in front of my office and I come to address them, that will make the press to carry whatever message I tell them and also to air their views so that the people in authority will hear them. So they probably just used me as a conduit to convey their information and grievances to higher authorities. And I don't see that stopping in anytime soon. They'll probably still do the same thing no matter how centralization of payment is made.
Let me ask you finally about the issue of, since we're talking about health personnel welfare, the issue of PPEs, the protective equipment that also seems to be something else that brings about a lot of hullabaloo. The health minister says that all the institutions, particularly federal ones like UCH, have been supplied with adequate PPEs and that the workers there do not have cause for complaint. Can you confirm this for us in the case of the UCH, and how are workers responding to that information that they have this protection now?
Well, let me first say that PPEs are the highest priced consumable in the health sector today all over the world. It's an item that is being consumed all over the world and at the same time. And many big countries are also coming to their knees because of the need, the provision that cannot meet the needs on ground. Yes, we've been receiving PPEs from the Ministry of Health through the Nigerian Center for Disease Control. We actually received last week from NCDC. So we do have a reasonable amount of it, but because of the rate at which we consume this material, it is hard to keep pace with adequacy of the material. So we will continue to need. It's like the more you give, the more it's used, and the more we need. So we still need some, and we'll continue to need until this pandemic war is won.
Professor Otsegba, thank you so much for your time and, of course, good luck as you continue to be part of the frontline response to this COVID-19 pandemic. Thank you for your time on the program tonight.
Thank you for having me.
At the moment in Nigeria, there are a total of 20,244 confirmed COVID-19 infections. Currently, 518 people have died, 12,807 people are still sick, while 6,879 people have recovered. The latest figures follow the addition of 436 new cases recorded in 18 states and the Federal Capital Territory, according to the NCDC. Lagos State in the southwest remains the epicenter of the pandemic with 8,576 cases. It has discharged 1,444 persons. The FCT is the second highest in the north central with 1,567. And Kano in the northwest has discharged the second highest number of recoveries, 712 of its total caseload of 1,190. River State displaced Edo in the south-south with the highest number of 874 cases in that zone, while Borno still tops in the northeast with 468 cases. Ebonyi in the southeast leads that zone with 234 cases. Plans by the federal government of Nigeria to cut the country's 2020 healthcare budget from its original 469.2 billion naira recurrent in capital expenditure owing to the economic impact of the COVID-19 pandemic is one that some of the industry's top players see as a move that will further affect the country's health sector negatively and may undermine the coronavirus response. With over 200 million people, Nigeria's health budget has over the years been less than 7% of its annual total spending on the health sector. This is against the 2001 Abuja Declaration, a pledge by heads of state of the African Union to commit at least 15% of their annual budgets to improving the health sector. A quick look at the health care budget in the last 3 years shows that 304 billion naira was earmarked for both recurrent and capital expenditure in 2017 out of the 7.28 trillion naira budget. 340.4 billion naira in 2018 of 7.166 billion naira total annual budget for the country was for health, and 315.6 billion naira in 2019. What will a 2020 health budget cut mean for Nigeria's health sector and the over 200 million Nigerians in 774 local government areas? Joining me from our Abuja studios is Dr. Ifeanyi Kismer, Medical Lab Scientist, the National Publicity Secretary of the Association of Medical Lab Scientists of Nigeria. Good evening, Dr. Kismer. Thank you for your time. Welcome to the program.
Good evening, Ladi, and good evening, Nigerians.
Now, a lot of people talk about the healthcare budget. Of course, we haven't ever met 15%, or the 15% pledge from 2001 till date. But given the fact that we're cutting the budget this time because of a health emergency, that is the COVID-19, there are those who will ask the question, should a lot more funding not be going to the healthcare sector? But it seems that's not going to be the case.
Ladi, that's not the case. The 2020 budget had been revised to about 10.5 trillion. And out of the 10.5 trillion, only a paltry 3.87% of the budget goes to the health sector. 19 years down the line, after the 2001 AU Heads of Government Declaration in Abuja to give 15% to the health sector financing, Nigeria has only been able to get to 6.03% in 2012. Ever since then, we have hovered between 3% to 5%. That is not very encouraging. And of course, the COVID pandemic outbreak has now exposed how fragile, how weak, how abysmal the Nigerian health sector and the Nigerian health system has been. Of course, partly due to poor funding. Funding is not the only challenge we have in the health sector that had put us abysmally low. Of course, across the African continent, we rank 38 out of 53 countries that were assessed on health financing. And so if you also consider that Nigeria is within the first 5 with the worst record of infant and maternal mortality, with the worst records in HIV/AIDS, you will worry more if you also take note that life expectancy in Nigeria is among the worst across the globe. So healthcare financing in Nigeria hasn't been optimal, and it should have gotten better because of the review we had of the budget following the pandemic. Let me ask Nigerians this evening. We have had several borrowings for infrastructure. What percentage of all those huge debts are we investing or has been invested in the health sector? The answer is none. And so it's worrisome. The average person in Nigeria should worry. Do you know why? We spend, if not for COVID-19, annually, we have capital flight of over 400 billion, more than the amount we budget for health, as capital flight for medical tourism. The president needs to do more. It's part of the promise he made. He needs to end medical tourism, and the only way to end medical tourism is to address the issues in the Nigerian health sector. There's an urgent need for a health reform And that reform should be speaking to issues about clinical governance and leadership. It should be speaking to issues about infrastructure. It should address issues about personnel. There's a global WHO tool for addressing workforce in the health sector. I wonder why we are yet to fully operationalize that in Nigeria. That is one of the things that will end the challenge we recently had when the resident doctors embarked on their 6-day strike because of the non-implementation of agreements and the hazard and the inducement for COVID. What is that tool? The tool is what is called workload indicator staffing need. Is WISN, W-I-S-N. We need to deploy that tool, and with that, we will address the issue of personnel. We also need to look at every tertiary health institution in Nigeria as it is aptly a going concern. That has not been done. You see, the worry is that every health facility in Nigeria, including the one in my backyard, a primary health care center, is listed and appropriated in the Appropriation Act annually. The question we need to ask is how much of those figures in the Appropriation Act really gets released in overall. Now we have about less than 400 billion in this year's budget. How much of it will be released? These are the issues we need to address. We need to speak to the issue of governance structures and leadership. I worry because at a time in this world and in this country, our hospitals, like the UCH Ibadan, was ranked among the first 7 hospitals in the Commonwealth of Nations, was ranked like any other hospital in the street of London. In fact, the UCH Ibadan used to be a center for medical tourism for the Prince of Saudi. Today, the reverse is the case, and the reason is not far-fetched. No Nigeria hospital has any form of accreditation. It's only one private hospital in Lagos that has accreditation. People who go abroad do not go because there's plenty money spent in those hospitals. They go because those hospitals conform to set accreditation standards.
Thank you so very much, Dr. Kesmia Ifeanyi, National Policy Secretary of the Association of Medical Lab Scientists of Nigeria. One can only hope that those who are in charge are listening and tailor the funds in that direction. Well, the health sector is often amongst the priority sectors in every budget in South Africa, with the world's largest HIV population and several initiatives to keep its 59.9 million people under health cover. This year's budget was no different. Delivered in February by the Finance Minister Tito Mboweni, the 1.9 trillion rand budget has seen adjustment in the wake of the COVID outbreak, particularly in the health sector. Today, South Africa crossed the 100,000 mark for confirmed cases. Here's Betty Divya to give us more details, but before then, a look at the health sector budget in South Africa.
South Africa's healthcare sector comprises a 3-layer public system at district primary healthcare, provincial and national healthcare levels, as well as a parallel private health sector. For the year 2020, the national budget of 1.9 trillion rand gave priority to the education and health sectors.
For a fast-growing economy, we need to make sure that our children are well educated, all our children, black and white. Our people are healthy, and our money is invested properly. Consequently, the largest spending areas will be learning and culture, which receives 396 billion rand, followed by health, 230 billion rand, and social development, 310 billion rand.
That's about $13.2 billion for the health sector, and this was to cover provincial and district health services, the National Health Laboratory Service, as well as training. But things have changed drastically. The COVID-19 pandemic has brought newer urgent needs in the health sector. A 500 million rand stimulus package announced by the president gave the health sector an additional $1.1 billion or 20 billion rand.
This funding will be used in the first instance to fund the health response to coronavirus. An amount of 20 billion will be directed towards addressing our efforts to this pandemic.
The needs in the health sector continue to mount along with the COVID figures, which experts say are yet to peak. All eyes are now on the emergency budget to be presented by Finance Minister Tito Mboweni on Wednesday to Parliament to see which sector gets what. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Let's talk to Betty a bit more at this point. She joins us from Johannesburg in South Africa. Good evening, Betty. Thank you for your reporting. Let's begin. Let me start by asking, how prepared is South Africa, given what the figures you've given us about the budget? How prepared is the country, the health sector, for the COVID-19 pandemic and the possibility of higher numbers?
Well, I would say a lot has been done. There are people who argue with you that there's still a lot to be done, including the health experts. With all the money by the way, there has been a reduction as well for the next 3 years in the health budget in South Africa, although the percentage, of healthcare budget to the entire budget is about 11. So that's not quite up to the Abuja Declaration expectation. So now from the seaports to the airports, the health centers have been beefed up to be equipped to handle COVID scenarios. They've revamped some existing hospitals and then a few new ones, and a number of field hospitals have already come up. I know the goal is about 1,600 or more field hospitals and quarantine centers that will have as many as 7,000 beds, to take care of those who get sick. But there are still issues, about PPEs. A lot of funding is going into there apart from donations from friendly countries and other donors like businessman Jack Ma that went to different African countries. So a lot is being done, but there's still challenges, and the government says we'll be dealing with them as they come. For the field hospitals, you have one in Gauteng here and a number of others. The other epicenters like the Western Cape, Eastern Cape. I know the latest one is either in the Western Cape or the Eastern Cape, put together by Doctors Without Borders and the Health Department. That's a sports center converted to a 60-bed center as a field hospital. So a lot is being done, but I know a lot will still be put into testing, as the president has said, testing and the care, and then support of fabrication of probably equipment that will help, the consumables, as well as things like the ventilators. It's already been done within the country, but we still have protests by healthcare workers who are complaining they're not being helped, they're not being protected. We have a number who have tested positive and those who have died as well. The shortage of probably medicine in some areas. Although government says we'll keep doing what we're doing, and fortunately the death toll is still relatively low compared to the numbers. With 1.3 million tests done, you have 101.5 thousand confirmed cases, but the active cases are just over 48. A death toll is still 1,991. So a lot is being done, but some will say more, and government admits that more could still be done. The projected figures for the peak of this was about 78 to 80,000, but now, as at June, we have crossed 100,000 confirmed cases. So it shows you that more could still be done, or more has to be done.
All right, thank you, Betty. Thank you for all that. That's a great deal of information about the situation in South Africa. Our Bureau Chief, Betty Dibia from Johannesburg. The World Health Organization has announced in the meantime that the economic effects of COVID-19 will have an impact for decades to come. This comes from its Director General, Dr. Ghebreyesus, who says as the number of infections top 8.7 million and the death toll has climbed to nearly 470,000, the lack of global leadership and unity to fight the coronavirus is also a much bigger threat than the outbreak itself. Dr. Ghebreyesus also criticized the United States pandemic response, describing it as too weak, too slow, and too China-centric in tackling the disease. U.S. President Donald Trump recently ended his country's relationship with the WHO, accusing it of having failed to hold China to account for the spread of the disease. That's our COVID-19 update. Thanks for being with us. I am Ladi Akiri Dodwale. Good night.